Hello everyone, a very warm welcome and a happy new year 2026 to you all. I hope this year brings you success, confidence and growth in your nursing career. So welcome back to Jacob's Academy of Nursing. Today we are going to learn regarding the topic joints and the vertebral column, also known as the spine. So this is a key foundation topic for first year nursing students, and it's essential for understanding movement, posture and safe patient care. So by the end of the session, you should have a clear and simple understanding of this topic to support both your examination and clinical practice. So let's begin our class. Now we can see the contents of this topic. We will begin with a brief introduction, followed by the definition and functions of joints. We will then look at the classification of joints, including their structural types with examples, and the different types and structure of synovial joints. Moving forward, we will focus on the vertebral column, its definition, functions, regions, curvatures, and intervertebral disc. We will also discuss the moments of the spine and, importantly, the clinical relevance of this topic for nursing practice. So by the end of the session, you should have a clear understanding of how joints and the spine support movement, posture, and safe patient care. Let's begin. Now we can see the introduction. The human body is made up of bones that are connected to each other by joints. Joints allow our body to move, bend, and perform daily activities such as walking, sitting, and writing. Without joints, movement would not be possible. The vertebral column, also called the spine, is the main supporting structure of the body. It helps us to stand upright, maintain posture, and protects the spinal cord, which is an important part of the nervous system. So by understanding joints and the vertebral column is essential in nursing practice, as it forms the basis for safe movement, patient handling, and recognize musculoskeletal problem. Now let us move on to joints. So first we can see the definition. A joint is a place where two or more bones meet. So the joints are essential components of the skeletal system because they connect bones and allow the body to function as a coordinated unit. So here we can see the main functions of joints include movement, stability, support, and protection of organs. Firstly, joints allow movement, enabling actions such as walking, bending, lifting, and writing. Without joints, normal body movements would not be possible. Secondly, joints provide stability, means particularly in weight-bearing areas such as the hip and knee. This stability helps maintain posture and balance. Thirdly, joints contribute to support by holding bones together and distributing weight, like body weight, efficiently. And finally, some joints help in the protection of the vital organs. For example, joints of the rib cage assist in protecting the heart and lungs. So by understanding the structure and function of the joints is very important for nurses, as it helps in patient assessment, mobility care, injury prevention, and rehabilitation. So in the next, we can see the classification of joints. Let us now look at the classification of joints, specifically the structural classification. So structurally, joints are classified into three main types. based on the tissues that connects the bones and the presence or absence of a joint cavity. So first one is fibrous joint. In fibrous joints, the bones are joined together by fibrous connective tissue, and these joints allow no movement or very minimal movements. So a common example of a fibrous joint is the skull sutures, where the bones of the skull are firm, held together to protect the brain. The second type is cartilaginous joints. In these joints, the bones are connected by cartilage, which allows slight movement. An important example is the pubic symphysis, which provides flexibility and support, particularly during childbirth. So the third one is synovial joints. So synovial joints are freely movable joints and are the most common type of joint in the human body. They are specifically designed to allow a wide range of movements and are found in joints such as the shoulder, knee, and hip. So by understanding the classification of joints is essential for the nurses, as it helps in assessing the movements, recognizing joint disorders, and providing appropriate patient care. So here one image is there for your reference. You can see for the labeling parts of the classifications of joints. Let us now move on to the types of synovial joints. So as we discussed earlier, synovial joints are the freely movable joints of the body and are the most common type of joint. They are designed to allow different kinds of movements depending on their structure. So here we can see examples and also the movements. So the first type is hinge joint. Hinge joint allow movement in one direction only, mainly flexion and extension. For example, elbow and the knee. The second type is ball and socket joint. So in this joint, the rounded head of one bone fits into a cup-shaped socket of another bone. So this arrangement allow movement in all directions, including rotation. So for example, shoulder and hip. The third type is pivot joint. So the pivot joint allow rotational movement. For example, atlas and axis, neck rotation. And the fourth type is the saddle joint. So saddle joints allow movements in two planes, providing flexibility. So example is thumb. And the fifth type is the condyloid joint. It's allow like two direction. Means joints allow movement in two directions such as flexion, extension, abduction, and for example, wrist joint. So the sixth type is the gliding joint. In gliding joints, the bones slide over each other, allowing limited movement. For example, include carpal bones of the wrist and the tarsal bones of the ankle. So by understanding the types of synovial joints and their movements is extremely important for the nurses and nursing students also. Particularly when assessing mobility, joint injury, and musculoskeletal condition. Let us now look at the structure of a synovial joint. Synovial joints are specialized joints that allow free movement between bones. So each synovial joint has several important components and together they ensure smooth, pain-free movement. So first we can see articular cartilage. So articular cartilage covers the ends of the bones. This smooth, slippery cartilage reduces friction and absorb shock during movements. So next is the synovial cavity. This is the small space between the bones which allows movement to occur without the bones rubbing directly against each other. So coming to the synovial fluid, it acts as a lubricant. So it will reducing the friction and it also help to nourish the articular cartilage. And surrounding the joint is the joint capsule. The capsule encloses the joint, holds the bone together and provides stability while still allowing movement. And coming to the ligament, ligaments strengthen the joint capsule. They will connect the bone to bone and help to prevent excessive or abnormal movement to reduce the risk of injury. So now from a clinical perspective, this structure is very important for the nursing students as well the nurses also to understand regarding the damage or inflammation of any part of the synovial joint can lead to conditions such as arthritis, joint stiffness and joint injuries. So understanding the structure of synovial joints helps nursing students and also the nurses to do the assess joint pain, reduce mobility and swelling in clinical practice. So let's begin our next topic on the vertebral column, also known as the spine. So we can see the introduction. The vertebral column is the central supporting structure of the body that protects the spinal cord and allows movement. So coming to the definition, the vertebral column is a flexible column of bones called vertebrae that forms the backbone of the body, support the head and trunk and protects the spinal cord. First, let us understand the functions of the vertebral column. So the vertebral column supports the body weight and especially when we are standing, walking or lifting. And the second one is protect spinal cord. So it protects the spinal cord when it is essential for nerve impulse transmission between the brain and the body. And the third one is allows movement, which means it allows movement such as bending forward, backward, sideways and rotation. And finally, it maintains posture. So helping us standing upright and balanced. So remember, support, protection, movement and posture are the key functions of the vertebral column. So now let us look at the regions of the vertebral column. The vertebral column consists of a total 33 vertebrae divided into 5 regions. One by one we can see. The first region is the cervical region which has 7 vertebrae and it's located in the neck. This region supports the head and allows movements like nodding and rotation. And the second one is, the second region is the thoracic region. So which has 12 vertebrae and it's located in the chest area. These vertebrae are attached to the ribs and provide stability. Next is the lumbar region. So consisting of 5 vertebrae in the lower back. These vertebrae are larger and stronger because they bear most of the body weight. And the fourth region is the sacral region made up of 5 fused vertebrae forming the sacrum. And finally, we have the 4 fused vertebrae which from the tailbone. Now an important exam point here. The first cervical vertebrae is C1. It's called the atlas and it supports the skull. The second cervical vertebrae is C2 called the axis and it allows rotation of the head. For the nurses, understanding this region is very, very important when caring for the patients with the spinal cord injuries like back pain, posture problem or mobility issues and all. Now we can see the curvatures of the spine and clinical conditions. The human vertebral column is not straight. It has 4 natural curves which help in balance, flexibility and shock absorption. So now we can see curvatures one by one. First one is cervical curvature. So it's present in the neck region, and this curve is convex forwards and develop when a baby starts holding the head upright. Next is the thoracic curvature found in the chest region, and this curve is convex backwards and it's present from birth. It helps in protecting the thoracic organs. So the third curve is the lumbar curvature located in the lower back, and this curve is convex forwards and develops when a child starts standing and walking. It plays a major role in weight bearing. And finally, we have the sacral curvature, which is present in the pelvic region, and this curve is convex backwards and provides stability to the pelvis. Now let us move on to the clinical conditions related to abnormal spinal curvatures. The first condition is kyphosis. Kyphosis is an excessive backward curvature usually seen in the thoracic region. So commonly seen in elderly patients or those who are having with osteoporosis. So the second condition is lordosis. Lordosis is an exaggerated forward curvature usually in the lumbar region. It is commonly seen in pregnancy, obesity or weak abdominal muscles. And the third condition is scoliosis. Scoliosis is an abnormal lateral or sideways curvature of the spine. It may be congenital or developed during adolescence and is often assessed using posture inspection. So for the nurses, understanding this condition is very important when caring for the patients with back pain and mobility problems or any spinal injuries. So remember, normal curvatures help in balance and movement, while abnormal curvatures lead to clinical problems. So in this image, you can see the curvatures, shape and all. Now we can see intervertebral disc. So these are present between adjacent vertebrae except between C1 and C2. They play a vital role in movement like flexibility and shock absorption of the spine. So first let us understand the structure of the intervertebral disc. So each intervertebral disc has 2 main parts. The outer part is called the annulus fibrous, and it is made up of strong fibrous cartilage and provides strength and stability to the disc. And the inner part is called the nucleus pulposus. It is soft gel-like structure that acts as a cushion between the vertebrae. So together these 2 parts help the disc to withstand pressure during movement and weight bearing activities. So now let us look at the functions of the intervertebral disc. So the first function is shock absorption. The disc absorbs shock while walking, running or lifting weights, so protecting the vertebrae from damage. The second function is flexibility. Intervertebral disc allows slight movement between vertebrae, enabling bending, twisting and rotation of the spine. And very important clinical condition related to the intervertebral disc is disc prolapse, like also called as slipped disc. So disc prolapse occurs when the nucleus pulposus bulge like through a weakened annulus fibrosus. So this can compress nearby spinal nerves, causing pain, numbness or weakness, especially in the lower back and leg. So for nurses, understanding the intervertebral disc is essential when caring for patients with back pain, mobility tissue, spinal injuries or posture problems. So remember, healthy disc protect the spine and allow the movement and prevent injury. Now let us move on to the movements of the spine. So the vertebral column is not rigid because of the intervertebral disc and supporting muscles. The spine allows controlled and coordinated movements. So there are four main movements of the spine. Let us go through one by one. First one is flexion. So flexion means bending the spine forward. For example, when you bend forward to touch your toes, this movement is called flexion. So flexion mainly occurs in the cervical and lumbar regions of the spine. So next one is extension. Extension is the opposite of flexion. It means straightening the spine or bending backwards. For example, bend your back backwards, that is extension. And the third one is lateral flexion. Lateral flexion means side to side bending of the spine. For example, when you bend your trunk to left or right, this is lateral flexion. So this movement is important for balance and posture during daily activities. So the fourth one is rotation. So rotation means twisting movement of the spine around its vertical axis. For example, when you turn your head to look over your shoulder, this is rotation. Rotation occurs mainly in the cervical and thoracic regions. So these movements are essential for walking, lifting, bending and maintaining the posture. So restriction of spinal movements may indicate conditions such as disc prolapse, arthritis, muscle spasm or spinal injury. So as a nurse, assessing spinal movements help us to identify mobility problems and provide safe patient care. So remember, flexion means bending forward, extension means bending backward, lateral flexion means side bending, rotation, it means twisting movement. So here one image is shown like movements of the spine: flexion, extension, lateral flexion, lumbar curve and the rotation. Now let us look at the clinical importance of the spine for the nurses. First one is back pain management. As nurse, we frequently encounter patients complaining of back pain. So understanding the spinal structure and movements help us to identify the possible cause of pain. And it will help to provide proper positioning, and also it will help to provide like support pain management and rehabilitation. So back pain is one of the most common musculoskeletal complaints, especially in hospital and also in elderly patients. So the second one is posture and patient handling. So correct knowledge of the spine is essential for safe posture and patient handling. So poor posture or incorrect lifting techniques can lead to chronic back pain, disc prolapse and also long-term spinal injuries in nurses. So by maintaining proper body mechanism, like nurses can protect both the patient and also themselves. So the third one is degenerative disorders. So with increasing age, the spine is affected by degenerative changes such as osteoarthritis, disc degeneration. So nurses plays a key role in early identification of symptoms, monitoring mobility limitations, supporting long-term care and comfort. And the fourth one is importance in elderly patients. So spinal problems are very common in elderly patients. So reduced flexibility, weak muscles and osteoporosis increase the risk of pain, falls, reduced mobility. So the nurse understanding of spinal health helps in preventing complications, improving quality of life, and also it will promote safe movement and independence. So remember, so knowledge of the spine is essential for the effective pain management, safe patient handling, maintaining degenerative conditions, providing quality care to the elderly patients. This is why nurse must understand spinal anatomy and functions. To summarize today's session, we have covered the key concepts of joints and vertebral column that are essential for nursing practice. And we begin with joints, discussing their functions and classifications, and followed by the types of synovial joints, including their structure and movements. We then looked at common clinical conditions related to joints, helping us link anatomy with real clinical situations. After that, we studied the vertebral column, including its regions and normal curvatures, which are important for posture and balance. We also discussed the intervertebral disc and moments of the spine, such as flexion, extension, lateral flexion, and rotation. Finally, we highlighted the clinical importance for nurses, focusing on back pain management, safe patient handling, degenerative conditions, and elderly care. Understanding this topic helps nurses provide safe, effective, and evidence-based patient care. Thank you. Thank you so much for watching today's session. I hope today's class on joints and vertebral column was clear, helpful, and easy to understand. If you found this video useful, please like, share, and subscribe to Jacob's Academy of Nursing to support more nursing education content. And if you have any doubts or any questions, feel free to leave them in the comment box. So I will be happy to help you. And stay focused, stay confident, and keep learning. Thank you once again. And I will see you in the next class. Bye.